For those of you who don't know, I'm Kate Baer, the Executive Director with United Way of Sheboygan County. We're really glad you're here to have this important conversation on ALICE. I want to share a couple disclaimers before we kind of really jump in. So the release of this ALICE report for Wisconsin comes during, obviously, as we all know and are experiencing, unprecedented crisis. Our world changed significantly in March 2020 with the impact of this global dual health and economic crisis, and ALICE remains central to the story in every U.S. county and state. The pandemic has exposed exactly the issues of economic fragility and widespread hardship that United for ALICE and the ALICE data work to reveal. So this exposure makes ALICE data analysis even more important than ever. The ALICE report for Wisconsin presents the latest data available. So it's a point-in-time snapshot of economic conditions across the state in 2018. By showing how many Wisconsin households were struggling then, this ALICE research provides the backstory for why COVID-19 crisis is having such a devastating economic impact on families in our communities. The ALICE data is especially important now to help stakeholders, like many of you joining us today, to identify the most vulnerable in our communities and direct programming and resources to assist them through this pandemic. As Wisconsin moves forward, this data can be used to estimate the impact of the crisis over time and providing an important baseline for changes to come and what we're kind of projecting is happening now and what may happen. So, what the ALICE report is not. This is also really important information to share. I'm just going to share it right up front. So it's not simply an income problem. It's not a political position, but rather a body of data that helps us understand the economic realities of this population. It's not a stance on raising the minimum wage. This alone would not help ALICE rise above challenging circumstances. It's not a finger pointing or finger wagging to Wisconsin businesses. The engine of local economics knows that in order for businesses to thrive, communities have to thrive as well. And it's not an us and them report. It's more of an illumination of daily financial struggles many of us face, including those who fall below the poverty line. United Way is invested in improving the community, and that means all members of the community. While there are different tactics for different needs, United Way focuses on strategies that fight for education, financial stability, and health of everyone in our community, the building blocks of a stable life. So we wouldn't be here today without our amazing sponsors. So I'll just take a quick moment to share with you our 2020 campaign kickoff and day of caring sponsors. As you can see, our diamond sponsor, Muth Mirror Systems, our gold sponsors this year, Kohler, Johnsonville, National Exchange Bank, our silver sponsors, Commerce State Bank, Quick Trip, Plymouth Foam, Masters Gallery, Sargento, and Sartori, and our bronze sponsors, Rockline and United One Credit Union. So we are thrilled to have these partners who believe in the work of United Way and the work our community does together. And they're excited to learn more about ALICE information too. So just a minute while I have some of my Torquay coffee that was left over from this morning. Also supportive of the work of United Way. So events are continuing throughout the day. We have our Acts of Kindness Challenge. You can visit our website, learn how to get involved. Lots of good things happening. And also lots of not so great things happening. And really, ALICE helps us look at that. So while many of you know I've been in the nonprofit sector my entire career, 15 years in management, I am also lucky enough to have been connected with an amazing team here at United Way, and I'm here to introduce them as my co-presenters. So we have Gina Cavalli. She is our amazing Director of Community Impact. She has been involved with United Way since moving to Sheboygan in January 2014. In her role, she facilitates the investment process by guiding the community action team and serving as the staff liaison and resource for the 22 partner agencies of United Way of Sheboygan County. Her expertise in collective impact also directs our 3 community impact initiatives. Super excited. Emily Kaiser, Director of Donor Engagement. She is passionate and in the world of giving. Her passion for serving others has guided her across a number of career positions and has given her a unique perspective. Growing up in a family that ran a small nonprofit, giving back was instilled in her at a very young age, which you can tell. She joined the United Way team shortly after moving to Sheboygan in 2019. And then Caitlin Piper is here with us as well to help deliver this information. She has been a part of the Alice Learning community for over 3 years. And she comes from a family of educators. Piper is passionate about educating the community regarding the resources available to them and how to invest in our community's future. So lucky am I that I am surrounded by this fabulous team, and we can't wait to give you this information and figure out as a community what are our next steps and what are we going to keep doing and what have we been doing. So on that note, Caitlin, take it away. Let's actually talk about Alice. Who is Alice?
Yeah, so I have the pleasure of telling you all about the basics, giving you a little launching pad for some of the deeper dive that Emily, Kate, and Gina are going to go through later on in the presentation. So let's start with the acronym. What is ALICE? Well, it stands for Asset Limited, Income Constrained, Employed. Really long acronym that actually it represents households with income above the federal poverty level, but below the basic cost of living in Sheboygan County. So when we're talking about the ALICE report, it's a snapshot, a point in time snapshot of those households. The metrics of this research really help out with understanding the financial hardships. It takes a look at the cost of living and really takes a deeper dive into the tough decisions that they have to make, that these households, families, individuals have to make every single day. So the report here in Wisconsin is actually produced by a team of researchers that use a collaborative model to provide research-based information that ensures these reports represent unbiased data. So if you are a nerd in the methodology behind reports, highly recommend you visit their website, unitedforalice.org. Not only is there more information on who was a part of the team, a little bit more of the background of the research, but also all of the information we're sharing with you today, the data, the fun graphics, that kind of thing. It's all on a really nice online portal, which is that website, so unitedforalice.org. The purpose of this report is really to better understand this growing portion of our population that just can't seem to get ahead. So traditional reporting on poverty doesn't capture the magnitude of people struggling financially. So the report, the ALICE report, fills in that gap. Helps us better understand the tough decisions that they have to make. And so that way we can move forward into working together to create lasting solutions. So this report is not just for us at United Way, but it is for our community. So if you are an HR representative, a business leader, nonprofit professional, I know we have a lot of you in here today, community stewards at large, really everybody can utilize this information because it really helps you understand our community better. So moving on to the next slide, it's a nice visual for a deeper dive. So now that we know, okay, on paper, what is ALICE? Who really is ALICE? So on paper, because the traditional metrics and reporting of poverty is so little for this group, this population, it's really exciting that the ALICE report pulls this out and really reminds us we know these people. They are the cashier at the grocery store. They're the nursing assistants at the hospitals. They're the professionals in education and at childcare centers. They're our neighbors, they're our family, they're our friends. They are, quite frankly, 26% of Sheboygan County residents. So who better to tell the story than ALICE themselves? Caitlin Deshane is going to cue up a video that was actually put together by our fellow United Way in the greater Houston area. So go ahead and take a listen.
My name is David, and I was Alice. I know
Can't
what it
see
is
it,
like to
Caitlin.
struggle.
I know what it was like to.
Can anyone else see it? Okay,
We're just
here we
gonna
go.
switch out a little bit here so that way it's a really impactful video. So we want to make sure that you can view it.
Yay. We had no sound in our mascot video this morning, so, but this is really, yeah, very impactful. Thank
My
you.
name is David, and I was Alice.
I know what it is like to struggle.
I know what it was like to work hard and barely make ends meet.
I work hard, but can't seem to get ahead.
Alice may not be who you expect.
Chances are you already know Alice.
It's hard to be Alice. You know, at night when I go to bed and the day's over and I have to think about, okay, this got paid, that got paid, but my car sounds weird when I turn it on.
I was dropped from my health insurance and I needed health insurance.
Any emergency would wipe me out.
Now, the fact of the matter is, none of us knows what tomorrow holds.
I don't have the extras. I am Alice. It is okay to be Alice, but I hope my kids don't have to go through this.
We know that creating opportunities for Alice to thrive is critical to all that we do. If you are Alice, working hard, struggling to make ends meet, United Way is here for you.
So like I said, that video was created out in greater Houston area. And even though those stories are of households there, they mirror the families and individuals in Alice in Sheboygan County. So this video really puts a visual to the weight that this population carries every single day. So on the next slide, who is Alice when we're talking about Sheboygan County? Well, as you can see by the graph, and I mentioned earlier, 26% of households in Sheboygan County are living underneath the Alice, they're an Alice household. Then 7% of households in Sheboygan County live under the federal poverty level, and then 67% live above the Alice threshold. So what is the Alice threshold? Well, actually what we call the Alice threshold is what we're adding is the Alice percentage, and then the percentage of households underneath the federal poverty level. So when we're taking a look at Sheboygan County, that's 1 in every 3rd households that are living underneath the Alice threshold. So those are families that are living paycheck to paycheck. They're making tough decisions every single day, and they are one emergency away from not making it. So the next slide is a great graphic. It kind of gives you a little bit of history in the last 8 years. And we go ahead, we put this in the chat. So it's a nice little 1-page sheet. So it really helps kind of bring out some of the highlights of this report for specifically Sheboygan County. So you also should have received an email for registering. So thank you for being here. And it should have been in that email as well, so you can reference it later. But as you can see, either on the screen or on the sheet of paper, yet 8 years after the end of the Great Recessions, families and individuals underneath the Alice threshold were already starting to rise before COVID. So the next slide takes another snapshot of the Alice household. So when we're talking about who is Alice, well, we can take a look at the household types. So you can see that actually a lot of households in Sheboygan County are either single, so they're cohabitating, or they're 65 plus, they're a senior. And I know that Kate's going to dive a little bit more into this topic later on. The next slide, really we wanted to just quickly snapshot the diversity and ethnicity of the Alice population. The Alice report really provides data that we can use to address important topics such as equity. So the fact that you can see the different large amounts of families living underneath the Alice threshold, this really speaks volumes to the importance of DEI work locally that is really starting to take shape in Sheboygan County. So these 2 last slides were great examples of how Alice households can come from all walks of life, but share that common thread of financial insecurity. So the next slide is actually talking about a Making Tough Choices challenge. So again, in that email that you received a couple days ago, there was a challenge. So if you were able to take the challenge ahead of time, go ahead and put in the chat what you got out of it. And let us know what your thoughts are. So for those of you who might not have seen that, the email got lost in your inbox or whatnot, this challenge really puts you in the shoes of an Alice household. So it gives you a scenario. So it could be, a family of 4, you make such and such a month, and then they start throwing you life challenges. And you have to decide, and you have to make tough decisions, such as paying to fix your car so you can transport to work, or do you want to use that money for quality childcare for your kids? So it's a really tough challenge, but it also really highlights those are real life challenges that these Alice households have to make every single day. So we can go ahead and actually dive in right away, because this makes a great point to the survival budget. So what's really great about this Alice report is it provides a survival budget, or what I like to call the bare bones budget, because it represents the average expenses for only the bare necessities. So in 2018, the average survival budget in Sheboygan County for a single adult was around $20,000 a year. And for a family of 4, about $71,000 a year. So that is significantly more than the federal poverty level, which is for a single adult about $12,000 per year, and for a family of 4, $25,000 a year. So it really helps us understand, okay, so this is the bare bones budget, and families in Sheboygan County might not even be making that amount to make ends meet, even just trying to make it on the bare bones budget. You can see on the sheet here, on the top, it says the median household income is just about $60,000 a year. So it's quite incredible to see this information. You can see that on the sheet, it actually has the bare bones budget on the back. So you can take a look and see that it is single adult. The top 3 expenses are food, transportation, and housing. Then for a family, the top 3 expenses are again food, transportation, and childcare. So again, how do you make those tough choices when you're already trying to make ends meet? You're one emergency away. This helps us understand, okay, that no wonder when it has to choose between quality childcare or say your mom, I'm going to choose my mom because hopefully she can help me out. But what happens when your mom all of a sudden has to go to work, or all of a sudden is not available? Then you are stuck with an unexpected expense all of a sudden to quick grab your neighbor to watch your kids, or make the tough decision to stay home and take the day off and not get paid that day. So it's a really difficult conversations, and these types of things just add to the cycle, because the Alice households, they're working with little to no savings. So that means they've got nothing to fall back on when an emergency happens, and they have nothing to work with to save for later. So this cycle continues. And we're here today to talk about how we can break that. So next up to talk a little bit more about the cost of living and workplace trends here in Sheboygan County is Emily Kaiser.
Thank you. So first, we're going to start talking about cost of living. And cost of living and workforce trends are really important to Alice households. Like Kate said, it's not the only thing that makes or breaks them, but it is really important when you're looking at the impacts that they're having. So there are 4 main areas where cost of living has the largest impact on Alice families and individuals that we saw in this last report. On the next slide, we have some images for that. The cost of living for Alice has grown in both urban and rural areas, and that's mostly driven by the cost of housing. And over the last 10 years, that's increased in both renters and homeowners. Additionally, the cost of childcare continues to increase while the options for childcare are actually decreasing. And this has pushed the average annual cost for childcare of an infant to more than average of tuition for an in-state public four-year university. So it costs more to send your infant to childcare than to send your 19-year-old to college, which is kind of crazy. Food insecurity has been a long-standing problem for families and children, but it's also increasing among single adults and seniors. And the impact that this is having on those individuals is larger than just financial. They know that food insecure seniors are more than twice as likely to have depression and 91% more likely to have asthma, among increases in other illnesses as well. And college students, that's the fourth area that we're seeing a cost of living trend. They've been facing a greater challenges in meeting their living expenses, even though the number of students who are working full or part-time has increased over the last number of years. On the next slide, we have a graph that shows the difference between the ALICE Essentials Index, which is basically that ALICE threshold that Caitlin mentioned, and the BLS Consumer Price Index. And the reason why this is really interesting is because of that large gap that you're seeing between the two. And the gap is mainly due to the fact that the cost of basic needs, especially housing, has increased, while manufactured goods such as apparel and cars have remained flat. So that's what's keeping the consumer price index low, is those other items that aren't necessarily essential to ALICE families, while the things that ALICE families do need to purchase are increasing at a much faster rate. And the main reason this is concerning is because that consumer price index is used to measure inflation. And so then it determines a wide range of government program levels and benefits. And so with them considerably underestimating the increased cost of living for ALICE households, they're also not serving that community as effectively. And these cost of living trends combined with the status of the labor force make situations more dire for ALICE families and individuals. On the next slide, we're going to kind of move into the workforce trends. The next slide, we have a graph that shows the population and where they're working. And you can see that a majority of adults are working in 2018. We also saw that most households have at least one worker. Only 26% of working adults have the security of a full-time job with a salary. The rest were paid hourly or worked part-time. And hourly and part-time workers are more likely to have fluctuations in income with their frequent schedule changes and variations in the numbers of hours they work every week. In addition, they're also less likely to receive benefits such as health insurance, paid time off, family leave, and retirement. Another interesting part of this graph is that 16% that's listed as not in the labor force. Now, we know in 2018, the rate of unemployment was much lower than that 16%. And although that is included in that number, that also includes college students who may not be working, adults with disability or illness that make it difficult to work, and also people who are staying home because of responsibilities, primarily caring for children. And so what that large number, that 16% really does is it allows for a large reserve of potential workers who can be drawn back into the labor force with only slightly higher wages. And that in effect is keeping wages a little bit lower. Now, I just want to touch before we move on to the next section, a question that had come through for us. Someone had asked what industries are they working in if they're full-time and still ALICE. So just to touch on that, we don't have, the exact industries per se, but we do know that obviously occupation plays a role in the likelihood of an individual to be ALICE. So the ALICE report breaks up the worker categories into two areas. They call them the maintainer occupations and the innovator occupations. And maintainers are primarily ALICE individuals and families. And so those maintainer occupations include those who build and maintain the physical economy. It would be construction, maintenance, management, administration, manufacturing, agriculture, mining, transportation, retail. And in addition, it's for those who care for and educate the workforce. So that's going to be health and education, food service, arts, tourism, and hospitality. Those are all going to be the workplaces that are going to be more likely to be employing ALIS individuals. The innovator occupations are those who implement existing tools or processes in new ways. So that's going to be managers, analysis, designers, technicians, policymakers, engineers, scientists, psychologists, and those in higher education. So hopefully that kind of answers the question about who specifically, which workforces we're looking at when we're talking about our ALIS individuals. So understanding the landscape of the workforce for ALIS families, we know that they have minimal job security and little or no savings, like Caitlin mentioned. So they often feel the impact of economic disruption almost immediately. So Kate is going to discuss the impacts that COVID have had on ALIS families.
Looking for unmute. Obviously, they will be tracking and following data closely of what's occurring right now. But we do know, again, because of what we've seen occur with this data and this latest report, what is happening right now around us. And we can just look around to see it. So the pandemic has really created two types of ALIS workers, those who are essential and still working, typically on site, and those who are non-essential, who are now working far fewer hours or not at all. Essential ALIS workers continue to keep our infrastructure running. Again, this kind of speaks to what Emily was talking about. And many do not have adequate, PPP, or they're risking their health in their positions.
Sure.
Oh, there we go. That's a really great thing about Zoom is, right? We can jump right in. And even essential ALIS workers are still struggling paycheck to paycheck, even though they've continued working through this time frame. And for many non-essential ALIS workers, the economic slowdown has severely reduced unemployment. So the industries where ALIS works, again, food service, leisure, hospitality, tourism, have been hit the hardest. ALIS is more likely to work in small businesses, which on average offer lower wages, fewer benefits, and have been also hit the hardest by this pandemic. The number of small businesses open in the US decreased by 19% between January and August. And it's scary to think of even how many more businesses have closed between August and today, October. So just in the month of September, to increase that percentage. If I speak to more families and children perspective of what's happening, again, we know ALIS households are described as one step away from being in financial crisis, which also surrounds them with other, modes of crises. And again, the reality is here we are. This was the one thing that would impact any family that was really in the ALIS threshold, but above federal poverty level guidelines. Almost 1 in 4 families with children in the US have income below the ALIS threshold. Again, we know 26%, no, 34%, 26%. Piper's like, wait, where's my stat?
And in the ALIS households, and then 33% live underneath the ALIS threshold,
yes,
which includes the federal poverty level.
Which also assumes that, yeah. So 33%, it's a huge population there. We recognize that for families and children, parents who need to work cannot stay home at home with their children, leading to health and safety issues. There's been a number of unsupervised children, having children and having to work to find appropriate childcare is a struggle, as well as connect with school. Again, our schools right now and our school administrators are working so hard. I have the privilege of sitting on a public health call with school districts every Wednesday, and my hat's off and kudos to these teams of public health and school districts, because the decisions they are having to make through this crisis are incredible, and they are doing the best they can. We know that internet access is a huge issue for families, and one might think, well, not here, not in this area, but the reality is that it is. Also, ALIS families will forego other supports and sometimes don't qualify for other supports. So that's the bigger part of the story. So free breakfast and lunches provided at school, or free and reduced lunch. Children don't always, either ALIS families don't always know to access it, or they don't quite qualify and they lose those supports. In a former presentation I did on ALIS with Chamber, we had a slide on let me find it here, food insecurity around free and reduced lunch and a Sheboygan County snapshot. So public schools had on average 41% of children, that's almost 7,000 kids in our county, who were utilizing free and reduced lunch as a combined number. And in private schools, about 30%, that was about 250 students utilizing free and reduced lunch in our county. The highest, then those are by districts, right? The average, and the highest by school was 96%, and the lowest by school was 8%. And so I bring that up because those are always numbers that United Way and our social sector community want to keep a close eye on to understand what our families are facing and what they're going through. Those numbers represent 2019. So what we know is all of those numbers have skyrocketed during this crisis. Schools report their full numbers in October, and they're available on the website, on DPI's website in November. So we'll know more as we kind of move forward and understand what's happening. Seniors quickly are also, any folks over the age of 60 are more susceptible to illness from COVID-19. Half of seniors in the US have income below the ALICE threshold. They have no extra income, little or no savings to cover extra health care costs. More than 40% of the US coronavirus deaths have been linked to nursing homes, which puts both ALICE seniors and ALICE healthcare workers at a greater risk. And we're seeing that here in our community as well. And not listed on there, but also important to note, is Black, Indigenous, and people of color face disproportionate challenges in areas of housing, employment with higher rates of unemployment, and additional barriers, as Caitlin pointed out with her housing slide. So that is what is happening during this crisis. Quickly, I can speak to, and Gina's going to get more into what we actively do as an organization, but the United Way Sheboygan County COVID-19 response was, I believe, well received in the community, in that we were able to, with partnership with Sheboygan Service Club, raise over $285,000 that we quickly disseminated in between the months of March and July to help kind of combat some of these issues I was just speaking to of this increased need. The fund itself has closed, but the fundraising has not. And United Way, again, is simply more than fundraisers. Together we are hand raisers, game changers. Stop talking, start doing, band together, take on the impossible taskmasters. And I share that because all of you in the screen and all of us in this community really need to come together to understand ALICE and rally around this population and anyone below the ALICE threshold. How can we support that? There were a number of other different resources that we were able to utilize for our community and show support. We met with the nonprofit COVID-19 Response Network weekly for over 15 weeks, and then bi-monthly. The volunteerism, we've tried to support these virtual opportunities, and then resources. We have a ton of resources on our website. Kohler Company, thanks to them, they kind of started this campaign of SheboyganCountyStrong.com, and all of this has been in support during this intense and chaotic time for all of us. A lot of people, again, like to say it's a new normal. I'm not quite sure I want this to be normal, so I try to say it's a new paradigm. There's lots of good information on that. We really invite you to take action and be a part of the solution, but up next, is that my part? No, see, I got ahead of myself. It is Gina's going to be here. She's our director of community impact and does a wonderful job of understanding how our investment in this population is making a difference and how we can continue to move this forward. So Gina, take it away.
All right, thank you, Kate. Yes, so what is United Way of Sheboygan County doing on a regular basis to help out our ALICE families and households in Sheboygan County? One of our primary functions at United Way is to support and invest in our partner agencies. And that is so important for our ALICE population in Sheboygan County because our partner agencies providing services in the areas of education, health, financial stability, they are the ones that are on the front lines of providing service to these households and these families. They're the ones with direct services and direct supports to these folks, trying to help them in the support that United Way can give them, whether it's financial support, whether it's resources, just brainstorming, collaborative working togetherness, in more of a collective impact mindset of how can we do more together, really helps provide a continuum of service and a continuum of care for some of our folks in the community, the ones falling under the ALICE threshold. I do want to highlight very quickly 3 specific organizations and share some impact stories that these organizations, our partner agencies, have provided and supporting our ALICE population in Sheboygan County. So the first one is the Family Service Association, also Consumer Credit Counseling. What they do with their budget and credit counseling program is provide one-to-one comprehensive consultation and budget planning with people, any people in the community. You do not have to be in the ALICE population, or you do not have to be under the poverty level. It could be anybody ready to make a financial choice, whether it's to buy a house or get married. And you can go in and you can get a free budget consultation with them. And this is a very in-depth consultation. You look at debt management, you look at how much money am I bringing in and how can I manage it to maximize my income so that I can still have some savings and I can still purchase what I need to purchase and maybe get a couple things I want as well. So at the end of the consultation, you come out of there with an action plan, laying out a road to financial success. So this program is essential for our ALICE families and households, and essential really for anybody who is, like I said, looking to make a financial choice. And what we have found through this program is that 79% of their budget and credit counseling clients, after they go through this process, will reduce their debt within 6 months. And at the same time, 65% of those clients are also increasing their credit score. So through this program, people are really finding a solid financial place and some stability when it comes to their finances. And one of the things that I really love about Sheboygan County and the nonprofits within Sheboygan County is that they're all interconnected and they support each other and they know exactly which organization they need to refer their clients to. And Family Service Association is one that is commonly referred to by many of our partners. They send their clients there all the time to get this valuable financial education. And one of those is the Family Connections. So I want to touch on their Connections program a little bit. The Connections program provides a financial support to families to help them pay the expensive costs of childcare. They'll pay up to, through this program, 20 to 25% of childcare costs for the participants in this program. And it's so important because what we know is that a $250 donation will cover only 1 week of quality regulated childcare for an infant. So that's $250 is 1 week of childcare for a newborn. And imagine not being able to afford that, and you're stuck at, with a brand new child. So many other costs in the world going on, and so they provide 20 to 25% of those costs to families in this program, which is so important for these folks to be able to afford that necessary care. And I want to tell you very quickly a story of one such family. This family fell under the ALICE threshold, and she was a working mom employed full-time. And unfortunately, her monthly budget was not enough to cover the high cost of childcare. However, she was making just a little bit too much money that she did not qualify for the state child care assistance programs. So she reached out to Family Connections, qualified for the Connections program, and was able to receive monthly child care assistance for 2 years. And during those 2 years, she worked with a case manager to address underlying issues and help her achieve stability in her life and in, financially, emotionally, mentally. She was also then sent to Family Service Association and participated in the budget and credit counseling program. And through that, she gained a lot of techniques and knowledge around credit and budget counseling and management of her debt, and was able to land on some financial ground that was much more stable than she had been previously experiencing. She was also able to participate in other programs throughout the community that Family Connections referred her to. And now at the end of those 2 years, she's able to live on an improved household budget. She can afford childcare on her own, and is so grateful to the support of Family Connections, because it really helped her manage her financial world, which so then she was better able to be parent, to provide the support her family needed her to provide. The next program I want to touch on is Lakeshore CAP's rental assistance program. And as Caitlin mentioned, housing is one of the top areas of expense for people and people in the ALICE threshold. And what this program does is help people maintain housing while they're still making those difficult choices as to what bills do I need to pay. They can at least rest assured that if they participate in the rental assistance program, at least they can maintain housing, and then they can make a different choice as to where their dollars are going to go. And what we have seen in the last year is a huge increase in need in this area directly related to COVID-19. So in July of 2019, 116 households were served by this program. In July of 2020, 379 households were served by this program. And that, again, is directly related to COVID-19 and the impact that had on people in our communities and their ability to pay for their housing. So I do want to share one quick story regarding Lakeshore CAP. They have a mom who is a parent of a newborn. In December of 2019, she had to stop working due to pregnancy concerns. She had her baby, everyone was healthy, baby went to childcare, and she went back to work at a new job, and it was at a skilled nursing facility. But just weeks into this new job, COVID-19 happened, and she was no longer able to send her child to childcare. And so she had to make that choice to quit her new job to stay home with her baby. She participated in Lakeshore CAP's rental assistance program and was able to receive funding to cover her housing costs through the United Way COVID Relief Fund, actually, and was able to maintain housing while she worked to obtain new childcare for her baby and get new employment. And we can only imagine that if that funding was not available, what would have happened to this mom and her baby? It's just heartbreaking to think about that. And so, so we're so grateful to our partner agencies and the services that they provide to our community members and our family and our friends in Sheboygan County, because without them, we would really see a lot more folks in more severe states of crisis. Before I hand it back over to Kate, I do want to touch on one last point. United Way is also, we know how important it is to help our ALICE families and individuals in Sheboygan County, and not just help them out here and there, but really let's break the cycles of poverty and help break this kind of generational poverty that exists. And one way to do that we have seen through various studies and research is a 2-generation approach to programming. And so we are currently actively researching a 2-generation program. What could that look like in Sheboygan County? What community partners need to come together to have the conversation of how do we work collaboratively? How do we support our families in this model? Because we know that it can and does break some of the cycles of poverty. So we want you to know that that is happening and that there's a lot of really good positive energy around those types of programs. And we are really excited to be having those conversations with our community partners. So I'm going to hand it back over to Kate, who's going to talk about how everybody can be part of the solution.
Thank you, Gina. I'm really appreciating all the comments, and it's always such an awkward space to be in Zoom where we're putting it in the chat and we can't have that kind of open dialogue. But what we're hoping to do is, again, continue this conversation. We just thought, what not a perfect day than today to announce the latest data and give this presentation. I just quickly threw some numbers in the chat that had to do with a question related to budgeting, and I also saw the comment from lovely Mr. Gallinetti, David, regarding, again, how do we take action, be a part of the solution, and really, without judgment, bring awareness to this population and these needs in our community. And I personally grew up Alice, so the cycle can be broken. How we do that, what that looks like, how we can be of support is something that I'm really excited for United Way and our entire community to kind of come together around. So some other notes I have in regards to this section is, again, while the Alice report uses data to highlight significant problems in Wisconsin's economy, stagnant wages, a rise of cost of living, 33% of our households unable to afford even the most basic budget, it can also be used to generate these solutions. And, we really wanted Gina to talk about this 2-gen model and talk about what's already happening. Because again, a lot of people don't know what's already happening in our community that really supports the Alice, folks underneath the Alice threshold. I think PATH is another amazing example of that. So providing access to healing, school-based mental health. We know that there are families where if a child needs mental health services and a therapist, they are not going to pay their deductible. That's $5,000. So they're not going to pay for those weekly or bi-weekly or bi-monthly session fees, even on a sliding scale, because they just don't have that money to do such a thing until they reach their deductible. And so that program, being a collective community impact initiative that uses collective impact model, has been just really a bright and shining, wonderful thing for our community that, again, addresses Alice. So we're trying to look at it from all the different angles, and we're hoping to have some more conversations where we can engage about this data in the coming months. Because again, policymakers, community organizations, identify gaps. I think someone put in the comments, this is great information to share with our policymakers, and how do we do that, and how can we use it to advocate for these families? All of these are things, and the information's all yours. This website, again, has an amazing dashboard that gives you really detailed information, and it's meant for the community to grab it and run with it and use it. Other things that folks through the Alice community have recognized that they've used in, because there's gaps in the workforce and challenges even during times of economic growth and periods of economic recovery. But some things that different communities have really looked at was accessing libraries, understanding health education and social factors. So just even the understanding of that, maybe addressing, is internet access an issue? How can we move forward? Another example in the Alice report is, are drug overdoses related by income, and how does that make a difference to Alice families and those we're serving? So there's lots of different things. We know that there's benefits of moving towards equity in Wisconsin among all of these areas, and most necessary. So in close, I would move to the next slide and open this time frame up for questions, right? Or just general conversations and comments. We are going to keep all the comments in the chat and try to address that. We have all of your emails for those who registered. We're hoping to have future conversations, but we'd love to hear from all of you. I'm glad there's a little bit of time left. It's a lot of data. It's a lot at once. Or you can continue to put it in the chat, and we will also look at that. Housing, affordable housing, I think I saw in the chat, was how do we use this information to really share with our community at large? the need for affordable housing. What does that look like? How can we support it? That is certainly something it was exciting to see the city of Sheboygan talking about among other municipalities in this county. So what are the concrete next steps for United Way? What are the best concrete next steps? Well, and there's a lot of different things we can do there. So Gary is a fabulous board member of ours who just posted that in the chat. And I would be open to hearing other people's ideas, but there have been ALICE task force created in communities. There have been different ways in which we just weave in the work of ALICE. So the chamber has a great committee called Business Education Partnership, and we recognize there's business folks on there. This is the Sheboygan County Chamber. There's folks representing education, and there's that 2-gen model sort of concept where that has been something that they were interested in, and these conversations need to come across all angles. So I'm looking forward to doing that and figuring out what's best. If you have feedback, email us so we can collect that too. And we will be providing more presentations like this in the community to different groups. So if you think you are a part of a group that could benefit from hearing this in this way, because it's a lot of data, it's a lot. What else do we have in the chat, Piper? Do you see anything, or Gina or Emily?
I think it really ties back again to the sharing of this conversation. And so we certainly are having conversations with businesses all the time. We are in a lot of, as Kate mentioned this morning, we're in over 130 businesses just for campaign. And when we're going in and talking about United Way and what we do, we're not just going in and asking for money. Our main purpose to go in and make those presentations is actually to spread awareness for the resources we have here in the community, so that everybody understands they have access to needs. So one of the questions in there is, how do you kind of soften that when you have a client that might not be willing to go and search for that help? There are so many wonderful resources right here in Sheboygan County, but there's a couple ways that they can reach out without having some of that, there's that pride, they don't want to lose some of that. And so 211 is a huge, wonderful resource that if you know someone who's kind of like, I don't really know where to start, I don't know that I need the help, but just want to see what's going on. 211 is a great online portal. So that's just 211.org. And you can take a look at what is all accessible online. They have a texting option. They have an online chat. So that way, if you're not willing to have those conversations or ready to have those conversations in person or on the phone, they can certainly do their own research. I know Mental Health America has a resource guide on their website as well. Quite frankly, if you know someone who is kind of like, well, it seems like they could use some help, highly encourage that you point them to an agency. And even if they're not the right agency, like Gina said, we are all very well connected in the nonprofit world here. So we will make sure that they get connected with someone that can help them in any kind of space or light that they're looking for help. So these are very important questions that you guys are asking in the chat. And so it's very exciting that we're having this conversation, even virtually, so that way we can hopefully spread that awareness for what's going on. The ALICE report really provides a nice little snapshot, but to your point, all of these questions are, okay, now what do we do with this information? Well, we share it. So really appreciate all of these questions.
There's that resource share, and thank you for bringing up 211 and all. Again, it's how do we get the resources in the hands of those that need them? How do we take away shame? How do we share that? And we've had a lot of good conversations as part of our nonprofit COVID-19 nonprofit response network, where 30 to 40 nonprofits are coming together going, a lot of folks, this is a new space to be in. Now folks have fell into ALICE. This is not something they've ever experienced, because they were doing okay. This pandemic then pushes them to have to understand these new resources, and it's going to be a challenge. So the conversation does not stop here. So we will be following up with all of you. And again, reach out to us if you want a presentation for your community, if you have ideas. We are going to take this information and we're meeting with our board around it in November as we continue to, of course, connect with the community. Serving the ALICE population has always been really a part of our strategic plan. And again, United Way has been here for, 90 years next year. So we've been here before this pandemic, during, we will remain here after. And I just want to, with the next slide, say it's important to thank you all for being here, because you are a part of the solution. Always do the ask. If you can give back in any way to United Way, please do. We're working our hardest to, again, address these complex issues facing our community. You know, as a community united, we can accomplish so much more than we can alone, and we all rise by lifting others. So thank you so much for being here today. We will follow up if you have additional questions we didn't answer. And we really appreciate you coming to learn more about the latest data, and we will keep spreading the word and creating programming and supporting collective impact that addresses these problems.